We are starting right now learning more about a brain-eating amoeba that is now confirmed as cause of death for a patient treated at the Prisma Children's Hospital. Due to privacy concerns, there is very limited information, though, about this patient. Meanwhile, many of you are sharing concerns and questions about signs and symptoms. News 19's Shelly Garzone sharing what you need to know, including myths about contracting this rare but deadly infection.
It does concern me a little bit because I don't know what would happen if we did catch it.
There's bound to be bugs in there, so I don't get in the water. And apparently there's been an outbreak of amoeba, and for that reason, really, I would stay out of the water.
Residents at Lake Murray are voicing their concerns after learning one person has died from being infected with a brain-eating amoeba. Tuesday night, state health leaders announced they believe the exposure occurred at Lake Murray. Prisma Health pediatric infectious disease physician Anna Catherine Birch confirmed the patient was treated at their facility in Columbia.
This amoeba infects the brain and it makes the brain swell. It is the majority of the cases that have happened in the United States are fatal.
According to doctors, this type of amoeba is common in freshwater in South Carolina, including lakes, rivers, ponds, or other still, warm bodies of water.
It's not an issue when we come in contact with it. That being, we accidentally drink the water, we accidentally get it on our skin, we're swimming, those kind of things. Where it can cause an issue is if water, forceful water, gets up the nose and is able to cross from the nose into the brain.
Symptoms include headache, fever, stiff neck, or vomiting. Doctors say symptoms can present between 1 and 12 days of exposure.
It's very important to let the healthcare provider know that you have had exposure to fresh water. The main reason is because the quicker we can make a diagnosis, the better the outcome could be.
Doctors say the infection is rare, but has more than a 97% fatality rate. With comments circulating around social media, News 19 asked doctors about ways the amoeba is contracted.
You cannot get this by ingesting. You can drink a whole glass full of water full of amoebas and not get sick from it. So it's certainly not going to spread through consuming any contaminated food.
Dr. Curry with the Medical University of South Carolina says this amoeba infection is not spreadable from person to person or caught through the bloodstream.
And these infections are all or nothing, right? So you're not going to get, asymptomatic amoeba infection. You're not going to get a mild case and have a doctor miss it.
Shelly Garzone, News 19 WLTX.
Shelly, thank you so much. And state health leaders say they're also sharing some numbers emphasizing how rare this infection is. The latest case, first case in South Carolina was since 2016. And over the past 62 years, there have only been 167 reported cases nationwide. The Department of Public Health says the amoeba is present in many warm water lakes, rivers, and streams. To reduce your risk, use nose clips and teach children to not get water up their nose. And it's always a good idea to avoid warm, shallow waters. We're also